grateful to have whatever number. I feel like going forward, we'll have a better way of double checking whether people, I will get the information much more faster than calling, because it's a county filled with almost I would say maybe 20,000 members, close to, and a district as a county too. Essex County is rampant in terms of COVID-19. So good evening, everyone. My name is Evelyn Ayum. I'm the chairperson of the Minority Leadership and Recruitment Committee. And we do have a few committee people here tonight, Joyce McRae, and we also have Martine Van Cole. She's also a new member with us. And we're happy that we have Dr. Lois Greene presenting to us again this evening. And before we get started, I'd like to do a little silence, just a brief silence in memory of individual people. Let's take a moment. So I thank you for that. We're going to go and get started. And that silence was to recognize how many lives have been eradicated because of this COVID-19. So many deaths. I think we're up to 300, about 300 and close to 340,000 people or higher if that's not the case. So again, welcome, Dr. Greene, and tell me a little bit about yourself.
Sure. So my name is Dr. Lois Greene, and I am a nurse by training. My background is in emergency room nursing, but I've actually been in home care. I've run an agency. I've done critical care, emergency. So my nursing clinical background is diverse. I, as an administrator, I ran outpatient centers. So I ran the ambulatory care center at St. Michael's Hospital. I ran it at Newark Beth Israel Hospital. And then I'm now currently the director of patient safety and clinical risk at University Hospital. So it really encompasses, how do we keep our patients safe? And if you've read any of the information on just being in a hospital, it can be one of the most unsafe places to be. So now with everything that's going on in the community, patient safety and ambulatory care has absolutely catapulted to just really show the community how important it is for us to maintain our health. And if I can share anything with you guys tonight, it's recognizing that as a country, the direction that we have been going in trying to improve our health is the best thing that we can do. And I'll share some information with you today about, what is it going to take. Last time I was here, it was abysmal. And so I'm very, very happy to be here tonight to let you know that things are different and better, but still challenging, recognizing that there's a race to get information to us about how to combat this disease, but this is a virus that is now in our community. I worked in nursing back in the 80s when HIV was sort of the plague, and everybody was really focused on it, and a lot of money was put into how do we solve the HIV problem, and we've made lots of strides. But let's be clear, HIV is still in our communities, it's still being transmitted, and it is still, it's not as deadly as it was back then, but it is still a formidable chronic illness in that there's a lot that goes into trying to stay healthy with that virus. So COVID-19 is, very similar, and we'll talk about that. Evelyn, did you want to do anything else?
No, you can go on and you can go on and get started. And those of you who are here, there are just a few of us, you can also put your information chat box, and we'll certainly get to those questions later on. So you can fill the chat box with your questions. And I thank you for attending, and you can get started.
Yeah, absolutely. Thank you, everyone. Am I sharing? Let me see. Let me go back to the share button. Okay. Evelyn told me I have to be patient, but it hasn't come up yet. Let's see. I'll give it another second. Are you able to see it?
It's starting, so you got to give it a little.
Okay.
Yeah,
Beautiful. All right. All right. So this is going to be sort of a continuation of what we talked about last time with all of the updates. And I think I mentioned back when I spoke to you guys before, COVID-19 information literally changes on a day-to-day basis. So this particular talk is going to really focus on what does it look like in children. What are the concerns that we have about cohabitation? You know, I have a personal story now because I actually had to do a rule out COVID for my own household, so I can definitely give you some information about if someone in your household has it, or in one of your students' households have it, how you can certainly guide them and direct them in how to stay as safe as possible. We're going to talk a little bit about the demographics, and then we're going to talk about mental health, because this has been going on for so long now. It has driven a lot of people right over the edge when it comes to their own mental health and dealing with isolation and all of the things that come out of that. So we'll have a conversation about that. And, you know, we're a small group, so I don't have any problem taking questions in the middle of this. You know, I look at educators as leaders, and that certainly that it helps us to leadership helps to manage the chaos, and utilizing leadership behaviors and providing vision and wisdom that definitely helps the community in exercising a decision and exercising good practices. So I just want to say thank you to all the educators because they make it happen. Just the definition of COVID-19, it has definitely been isolated and identified as a severe respiratory illness. It's caused by the coronavirus. The coronavirus is one of 7 coronaviruses, and the common cold is a coronavirus. So you can see how the fact that this is a very common sort of strain, but the way that it kind of is able to hide itself essentially and not necessarily be detected by the body's immune system is what makes it so deadly. The most devastating thing is the respiratory failure that develops as a result of it. And so people who have, you know, the multiple comorbidities are the ones that are at the most risk. In children, and I keep saying that children they present with very mild, very significant symptoms, in that usually if a child has COVID, and there's been a lot of study that's been going on in New York, they're going to present with a fever and a cough. Everything it's not always, but it definitely, children are going to elicit a fever to this virus. There's other symptoms that this happens in adults, but it also can happen in children. That's that loss of taste or smell. And it's very significant. People are like, I just can't taste anything. And they're not able to smell, like even strong pungent odors, they're not able to smell. The sore throat, shortness of breath, and difficulty breathing are one of the symptoms that will bring people to the hospital. I want to say the good news is that in working in the hospital, the things that we're seeing now, at least if this is the beginning of it, are not like what we were seeing in March. In March, people would come in, many people would deteriorate. If you made it to ICU, many people died. Now we have some people coming in to the emergency room, but many people are not. Many people, and you see how many people in Washington are getting COVID and not necessarily getting sick enough to be hospitalized, because it's really going to be the respiratory symptoms, but they're, you know, managing the symptoms, getting the medication, because they've recognized that COVID is an inflammatory illness, and if you can manage the inflammation, a lot of people do well. The nauseousness, diarrhea, vomiting in children, we see this as well. Tiredness, muscle aches, body aches. I've spoken to tens of COVID-19 people who have it, and the body aches and the muscle aches are something that they can children, especially under 1 year old, they're not going to feed well. They're not going to be hungry, and they have this poor appetite. So it's a very classic presentation. So recently, my husband showed up with a 106, 102, 103 fever for a couple of days. So I had to take him to go get tested because I didn't have another source of where this was coming from. So part of that, once I realized, because I'm not a panicker, but once I realized that this fever was kind of high and then it wasn't going away and he was lethargic, then I had to, do the COVID shutdown in my own home. So basically it meant that, we had to kind of isolate him to one room. And this is whether somebody is being suspected of COVID or if they actually have it. You want to try to minimize the area of the house where they're going to operate. So if you can, and not all of our community has the luxury of having more than one bathroom, but you could try to isolate them so that they're only using one restroom. Unfortunately, my house is small, so the main bathroom is upstairs, so we had to have sanitation routines when you're in the bathroom. So I had to make sure that, when he's using it and when he would come out, that things would be clean. So trying to limit contact, trying to make sure that if he's moving through the house, that he would have to be masked. So even when I had to take him down to go get tested, to get him through the house, make sure that the person is masked, because what you're doing is limiting the droplets. And if you can limit the droplets, then you can limit the spread, right? So if he had to eat, we actually brought the food to him in the room. So the person that has COVID should eat in a separate area because, of course, you can't eat with your mask on, so that you would want to limit the area of the droplets to one area. Of course, avoiding sharing personal items. It's harder than it sounds. Someone calls on the phone and it's like, oh, it's free. And then you're like, oh, wait a minute, I've got to wipe that phone down and make sure that when you're sharing common items and you don't realize how often you do it, that those personal items are wiped down. The good thing is that COVID is very dangerous inside of a human host, but on surfaces, it's broken down very easily by soap and water. So making sure that, things are wiped down, that, like we talked about, source control with the mask, making sure that you're washing your hands. And then when you're doing laundry for the person that potentially has COVID, that you're not, shaking out the laundry or, digging in, just being very conscious that these droplets can be on the laundry, so you're not going to try to continue to aerosolize them. If you have trash cans, try to use a liner so that you can encase everything, fold it up, and then put it in another, and then monitoring your own health. Certainly, if you're someone who's living with someone who has COVID, do not panic. If you manage the source control, there are plenty of people, and I have relatives who have taken care of people who have had very significant, body aches and just really bad COVID-19 presence and not gotten it if you manage the environment and manage containing the virus to just the one area. I want to stop and take questions if you want. All right.
Okay.
Yeah.
I want to redirect again just a quick question in relationship to children who are infected. What is their recovery rate looking like now in the hospital? Recovery rate of children.
I'm going to move forward to, let's see. So when you look at cases, gotta slow down. When you look at cases by age group, and I hope you can see this slide.
Yes.
If you see this 0 to 4, this is the percentage of cases, and you can see that children are the lowest as far as, contracting it, keeping in mind that this is in 99% of cases, right? So when you're looking at who gets it, the age group is quite high, quite low for children under 17, right? The largest numbers so far have been in this 18 to 64 group, and percentage-wise, over 85s are getting it less. But when you go over to the blue area and you look at the percentage of deaths, right? So even though they're not getting it very much, the older group, the percentage of it, they're the highest when it comes to how it impacts them. Because they're a fragile host, they very often have multiple comorbidities and are not, are some of the most challenged when it comes to managing this disease. So it is significant to see that when you look at death in people under 29, it's very low. That's why you see these athletes who are, kind of just taking it very, very callously. The unfortunate thing is that these people are the ones that are infecting these people, and they have a poor outcome. So does that answer your question about?
Yes, thank you so much.
So,
yes.
So
I have
we
a
can look
question.
at, sure, please.
Okay, so what, besides basically wearing the mask and staying home, like, is there vitamin C, or are there like any over-the-counter things that we can take to pretty much like
Are you
strengthen
talking
our
about
immune system?
Are you talking about if you have it, or if you are trying to keep yourself as healthy as possible?
Both. I'm trying to prevent it. I unfortunately, I still work outside of the school where I have to be out and about. And if I perhaps do get it, what can I buy now before this lockdown to stay at home or to take steps that I can make? Because I live by myself. If I get it, I'm very much going to have to nurse myself back to health.
So let's be clear, right? The best thing that you can do when you're trying to manage any illness is be as healthy as you can be. And this disease, the healthier you can have your immune system, and that's why, and I'm not a nutritionist, but I personally, I would take my vitamin C, make sure that I exercise, make sure that I'm eating well. Like, I'm not gonna. It was a challenge at the beginning of the pandemic because it was very, very scary, and I think a lot of people, and I'll talk about it later, didn't necessarily. It was almost like it was doomsday, and so people weren't like focused on how do I optimize my health. But when you look at the statistics on who does well, the healthier recover better than anyone who has a pre-existing condition and is not managing it. So my uncontrolled diabetics are doing worse. My young people that have, obesity that's not, not in any check are all doing worse than people who are healthy. So I tell everyone, I have an 80-year-old mom that lives with me. I have, teenagers that are in and out. It's about optimizing and managing your immune system now. And stress and worry deteriorates your immune system. So it's something that you've got to look at all of the things that impact the immune system and try to optimize that as much as possible, especially when you live by yourself. But my statement to someone who lives by themselves is, if you get any symptoms and you begin to have shortness of breath or difficulty breathing, you would get yourself to the nearest hospital, because the treatments that I'm seeing being used now are working. People are being discharged, and that is so encouraging. When people come in, they manage the inflammatory response. There's all of these new drugs that are getting approved by the FDA, and we are using them in the hospital, and they are working. So.
Well, I can't avoid the stress. As a teacher, we have all of these things that need to get done, but I'm trying everything.
You can't avoid. I couldn't hear. I'm sorry. Your audio's a little bit. The stress, I know, but we got to manage it, right? We've got to do some self-care. It's almost like when you're on the plane. They say that you've got to put your own oxygen mask on first. So, and I'm speaking to myself as well as I, navigate this. I gained 40 pounds during the initial surge. It was wine and carrot cake every night. It was like I couldn't keep that up. I had to change what I was doing, and then it's a day-by-day work to help ourselves and to manage our stress and to, because I'm literally, it's so funny, when I first started going to the hospital, that's when everything shut down. So I'm driving into the hospital and everybody else is going away from this building. So it was hugely stressful. And then I was on the team that was helping, the bedside nurses and just supporting them they're walking into the fire every single day. And this is not, when they signed up in nursing school, it wasn't what they signed up for, but it's what these people needed us. And so it was a matter of, okay, recognizing that I'm a human being and that I'm, I have fears, I have families, I have all of this. How do I do my job and manage myself? And that just came down to coming back to the science. I can't tell you how many nurses went into how many COVID-19 rooms, critical care patients, patients on ventilators, patients that are spraying, and with our personal protective equipment, they didn't get sick. I went in every day, and I'm grateful, did not get sick. So coming back to the science and the, staying calm it's helpful, and just doing what we know we need to do. Even with the masking, and I'll go back up to this because I think it's important. The CDC put out all of these education around how important masks are. And when it first came out, they said just put a face covering on because they really needed people to just source control, but recognize that there's different types of face coverings. And as a teacher or somebody who is working with people who you don't know whether or not you're going to be exposed to COVID, you wear the best mask that you can. And so making sure that it covers your nose and mouth. I can't tell you how many people I see, with the mask just over their mouth or under their neck. That does nothing for you, and then they're like, I don't know how I got COVID, because you don't wear it properly. Even in the hospital, I'm managing people who are touching the insides of their masks. If you're doing source control and somebody has it, they're touching the inside of their mask or even the outside of their mask and then touching surfaces, you're still spreading. So hygiene, source control, and social distancing, the best ways to keep yourself safe. Okay. I'm going to say that all masks are not created equal. I've seen these, and my son actually had one of these, and I had to educate him with the exhalation valve. So part of the reason why we source control with masks is because I could be an asymptomatic spreader. And if you have a ventilation mask, if I had a ventilation mask on and I had COVID, I'm essentially exhaling COVID out to whoever's in my surface. So I don't get on an elevator with anybody with one of these on because it's not protecting me from what they potentially have. And there are many, many people who are in the community that are asymptomatic, do not have any symptoms, or even sometimes I hear people, like I was in the supermarket today and she's like, oh, I think my allergies are just acting up. And I'm like, that could be COVID. They don't know, but you have to operate like you do. So wearing a mask that completely covers your nose and mouth, one that fits snugly against your face, because sometimes you see the gaps, and that's at least 2 ply.
I'm sorry.
No,
I don't want to
please.
interrupt. So I'm looking at the pictures. So the mask, okay, so like right now I'm at work. I have a mask and I have a face shield.
Okay. So the face shield
is it counterproductive to have the face shield, or face mask alone would be sufficient?
The face mask alone is as long as everyone that's in your classroom is wearing a mask. The face shield we use face shields at the hospital when we're doing care, but we're walking into patients' rooms that do not have on masks. And very oftentimes they're coughing so the face shield is another area of protection. I've seen people with face shields and no mask. That does nothing. The face shield is just in the event that somebody was coughing and the droplets are actively going into the air, that it would not get on you. So the face shield is an extra protection when there's a potential for things to be aerosolized. The important thing, I think, is that's really effective is the use of a surgical mask or use of a more than 1 ply. Definitely making sure that you can't blow a candle out. And there's like great videos that are out there that show you how ineffective some face coverings that some people wear are. So it's really important just to have especially when you're in an environment with children and you don't know, what's going on in their households, because many people, and I think I mentioned this, many people that are working do not have the luxury of infection control time, meaning that if they don't work, they will not get paid. So that makes them highly motivated to come to work if they can come to work, whether or not they know they're sick. So it's important that we, have hand hygiene. And that's one of the recommendations that when you're at school, you're like, what do we do? Because there's other countries where, kids, there are very clear directions on what kids should do. And probably the number one thing is that kids should not come to school when they're not well. And that's something that I know I'm guilty of because I'm a nurse, right? So if my kids had a sniffle, I love Dimetapp. I could medicate them and I could, get them out the door. They wouldn't have a runny nose all day, and I could work because I had to work. So kids that are sick should not be in school. That's probably the number one thing. Regular sanitation, making sure that kids understand, similar to how when we do fire drills, you're going to have a sanitation drill or something where, we're going to wipe down our desks now, or we're going to, clean off this. It's got to be a part of the environment in schools, especially if a kid has been sick. The one thing that's not really happening as consistently as it needs to, and especially when things, kind of go back to, I hate to say this, but back to, more in classroom or more normal, we're going to have to really document what our contacts are. So kids should not be coming in and out of classrooms and you don't know who's in there, because when it comes back time for contact tracing, and you need to know, like, how long was, so-and-so in this area of exposure, because contact tracing is all about time and exposure. So if I had on a mask, you had on a mask, and we were together for an hour and a half, the likelihood of either of us contaminating each other is very low. But when you're in the break room and
So I'm sorry.
Please.
I have another question. I'm so sorry. So would you work in a building that had no windows with children?
So I work in a building that has no windows with children.
No, would you? Oh, you do?
Well, because hospitals, we don't have, lots of our rooms don't have windows. And the windows that we have are not open. However, we do have, specific ventilation. So what I would say is that you have to optimize. Certainly if kids were sick, I wouldn't, they couldn't stay in the room. But you have to have somebody do an environmental assessment of how often air exchanges in your room. And these are conversations that I think educators and people that are working in buildings, even office buildings now, need to have these conversations, because no one ever thought about that before. It wasn't something. So I am in closed, like even my office space that I'm working with it's not designed for patients. So, the air exchange is not at the degree that a negative pressure room would be, but I keep my mask on, and in common areas in our office, we keep our masks on. So it's not optional. I'm doing this, and this is what we do. If I'm in my office by myself, I can take it off, but not in a common area. So it would all be about source control if there's no windows.
Thank you.
No problem. In limiting contacts, a lot of schools have had to look at, we used to change classrooms quite a bit. Again, because of the way that the outbreaks are happening, just trying to be as conscientious as possible about how many times you mix up different groups. I think that's, and then masking, and kids seem to be very adaptable. Every supermarket I'm in, I see kids in masks, and I think because they tend to model adults and they see all the adults in it, the kids are wearing it. And so it's going to be a matter of reinforcing it and making sure that, you have source control. But I showed you the data on the children, so it's very a low amount of children that actually get COVID. The asymptomatic information is still out, so cautiousness you can't be too cautious. I think I was showing you the deaths, right? And so I think we looked at this slide. I skipped ahead. So this is by race and ethnicity, keeping in mind that every municipality doesn't have the same rules about what they collect, the data they collect. So this is on essentially 50% of the cases of deaths, or over 4 million deaths. And when you look at the cases of COVID by race and ethnicity, certainly white people, because they're just larger in the community, get it more often. and then Hispanics are the second largest group. And you look at African American, it's a less, as far as third in the number of cases that are reported by ethnicity. But when you go over here to the deaths, certainly Caucasians still lead because there's just a larger number of them. But when you look at the deaths compared to the number of Hispanic folks that have it versus the number of Hispanic folks that die with it, it's lower. And then you look at the African American group, it's a higher number of African American by percentage of those of us who have it that actually die from it. And that, again, can be contributed to, and the jury is still out because this represented 78% of deaths, but it really has to do with all of the comorbidities, the fact that they, when the lockdown happened, a lot of ethnicities were able to just pick up their work desk, get a VPN, and go and do their same job in their home and be protected. Many of the frontline workers and people that were working in, service industries were not able to have those same luxuries. And then by sex, it's, go ahead.
I was going to ask something in relationship to our own geographical area when we're talking about Essex County, the demographic rate in reference to that particular area. Okay.
Sure. So when you look at this is yesterday's statistics of cases in Essex County. Oops, sorry. Okay, in Essex County, and you can see that they recorded, the number of cases, the number of deaths, and the current deaths. And here's the problem. So this is all of Essex County, and when you look at Newark, compared to, this is the number of cases, I have a block here, okay. Number of cases that were reported on 11/21 in the city of Newark, in all of these cities, right? So the next highest was East Orange with 49. Newark had 277 cases reported, which is why I think the mayor is losing his mind, because not losing his mind, but so upset and so trying to figure out how we can improve the way it's spreading in this community. So these numbers are all of Essex County.
Wow.
And you see, there are some municipalities that just had one
Right.
case, 49 cases. Essex had 0. Right? So it's a significant, disproportionate, impact to the Black and Brown communities just in this one county. And if we look in other states, they're having very similar, and a lot of it has to do with, again, whether or not folks believe that this is a real virus. And I think when folks don't have, viruses are, you can't see them. And if you are just living your life and haven't lost anyone to it or haven't, been impacted by it, you may not take the same precautions as someone who listens to the science and then says, you're not coming in my house unless you have your mask on, and we're not, we're going to follow the rules. So this is quite alarming and quite challenging, considering the impact and the mortality of the people that get it in these towns. They're going to be a lot worse off than folks that, shake it off. All right. So it's here. And so you've heard a mad dash on the TV just talking about we've got to get to the vaccine. And vaccines have been very effective for diseases that have, impacted children, smallpox, we've eradicated that. The flu vaccine is quite effective. There are currently 54 vaccines that are in clinical trials in humans under investigation just around the SARS COVID-19 virus. All right, they're going on all across the world. So the United States currently has 400 clinical trials that are going on. Canada has 36, but across the world, everybody's looking for how can we eradicate this from our community. I'm going to show a slide that just has a few this is just like the top 20, I think, of the current vaccines that are in clinical trials that are close to getting to the point where they'll be used on, be distributed, all right? And there's lots of barriers. The one you keep hearing about is the Pfizer one that's right here. They've put over $500 million into getting this vaccine to market, keeping in mind that some of these vaccine trials had been in place prior to COVID-19, but it didn't, the work that was done wasn't kind of catapulted until now, you know, the money is being impacted. So once you have to close down my business, now it's urgent that these things get to market, keeping in mind that the companies that are working on them are making a huge investment and they expect to get that investment back. You know, I always go back to the fact that there were tests in other countries prior to the United States getting testing. You know, it was a monetary thing where we had to have our companies develop a test and then, you know, be able to charge the government and charge the insurance companies for the U.S. test. But my cousin lives in Singapore. They were testing in January, everybody. So it's a little bit of an atrocity in my opinion, of how much the economics of our economical, what do you call it, perspective drives what's done. You know, a lot of research is not being done to eliminate a disease because the pharmaceutical companies have been incentivized by disease chronicity, not curing. So it's just, I'm sorry, I'm a little jaded when it comes to that. But so these are the top 20. A lot of them are working on sorry, I was going too fast. Are working on a platform that basically tricks your body. So you get a attenuated or a not active version of the virus, and then your body's immune system elicits a response, and that's what gives you the protection. So a lot of these vaccines are working similar to the flu vaccine, where it sort of gets your own body to develop the antibodies, and then they're still looking to see how long that antibody protection lasts. And they're doing it this way, right? Because you're going to need, some of these require 2 shots, some require 3 shots. Of course, you're going to have to get, you know, injections every year to make it worth their while. Sure.
So if my body has formed the plasma or the antibodies, I would not need to get the vaccine, correct?
If your body has antibodies, now the thing that they have identified is that people that have gotten COVID-19 have developed antibodies. The antibodies then go away and they have gotten it again. So knowing the exact length of time, they do not have any idea exactly how long, depending upon how much you were exposed to and how much antibody. It's not like chickenpox, right? Where chickenpox, if I get the chickenpox, I develop antibodies, and pretty much for the rest of my life, with the exception of shingles. Right, it's the same virus as chickenpox, but I essentially can get it again, and I have actually, in the form of shingles. But for most viruses, when you have, it's like once you have the antibody, that's why they test you for, I'm blanking now. You have to get a shot 3 times to develop the antibodies to make sure you don't have this. And I'm just blanking on the name of it. But yes, in theory, your body should elicit the antibodies and you should be forever immune. It is not so with COVID. They have actually done research and shown that people have gotten it again. So depending upon how long these vaccines, how they work and how long their immune response works will depend. And that'll be sort of the race, because there's so many companies that are working on it and there are people working on it across the world. There are going to be companies who are motivated in trying to find a permanent, you know, something that's going to keep, not going to cost a lot of money and be able to have the longest response. So that's healthy competition, because again, you've got tests that are coming out that are $200, $250 a test, because they recognize somebody wants to have a party, they're testing everyone, they're, you know, spending the money. So we have a very challenging situation just being where we are because we could not shut it down. Other places have shut it down. Like in Singapore, there's no Singaporeans that have COVID-19. Anybody that's coming in gets quarantined for 2 weeks. They find it. You have to, get treated and eliminate it. But we cannot, in the foreseeable future, ever get to that stage. Just with the amount of people that won't wear a mask. So our numbers, and I'll show you. We'll go to another site if we have time. I'm not sure. I'm looking on time. Anyway, so just recognizing that everybody has anxiety, right? The unknown, and they've actually surveyed educators, and you guys are more concerned about your students and their families and the risk, as well as your own family members than sometimes your own risk. Having the right supplies. I can't tell you how many times I've gone into stores that are selling, and then the hand sanitizer is run out. We have to do the same, the same advocacy for ourselves as the store employees. They need to replace and replenish their sanitation supplies, and it has to be consistent. And I've got to, say my hats off to the hospitals, and they have done an excellent job in making sure that they stockpile the PPE that's needed and the sanitizer that's needed, and come up with different ways to make sure that people that are working in those environments stay safe. The media information that's being given can be very challenging. They make money by sensationalism and people watching. So a lot of the information that we're getting, you really have to vet. And then I think another part of the anxiety is just how I'm an educator myself. I teach a couple courses for Rutgers and for Ramapo. What are these kids learning? How are our kids are they going to be able to step into the necessary roles based on the education that they're getting now? So there's good things, and then there's, things that we just don't know. Signs of COVID stress. We all deal with this, and we talked about this a little bit earlier, just your own fear and worry. It's so funny, you walk into a group now and somebody starts coughing, you get this panic because you just don't want to be contaminated by someone who's being careless. There's a lot of serious stress both for our students and for ourselves with, financial situations. Is everybody's job going to be safe? Do we have the support services that we need? Some people lose sleep, they're not able to eat. There's, difficulty concentrating. Chronic health problems. If you're not managing your chronic health problems, they only get worse. So I know I've just been able to, make my own appointments and making sure that I'm managing my physical health. And then there's mental health, which our community is challenged with anyway. We not necessarily a community that embraces mental practitioners and therapy or counselors or that kind of thing. So it's something that is only worse in the midst of a pandemic. And then, just using the vices, the things that make us nervous, we do things to make us calm. So some people smoke, or they are going to drink more alcohol, or, for me, it was carrot cake. It was just like we do whatever we can to manage our stress, and it doesn't help. So signs of stress need to be managed, and there are mental health resources out there. And I can't stress enough how important it is to kind of check yourself. And you can know when you're off, but sometimes you can't always know when you're decompensating. And so, folks are telling you that you're, kind of going off on them, or you're, not yourself. It might be time to just, take some time to get some mental health. And these are just some resources. And maybe even for our kids, I know that stress, especially loss of a job, can lead to more domestic violence issues at home, child abuse, just parents who are stressed and don't have the same income that they had before, taking it out on children. So recognizing that, child abuse and, some of our frontline workers are our CPS workers because they have to still go into the homes and make sure that the kids are taken out and that they're safe. Elder care, a lot of people that have lost their jobs, people that are older are being abused because they're not getting the care they need and they're being taken advantage of financially. So there's a lot of ripple effect stress that's happening because of the pandemic, and because everybody's in their house, not everybody is seeing it. One of the things I always try to do and try to make sure that we do is that everything is not, doom and gloom with this pandemic. We have to focus on not just the bad things that have come out of it, but some of the good things that have come out of it. I like to, there's a story, and you might have heard it. It's about a farmer, and he, lived in a town, and he had a horse and a son, and he was happy. One day, the horse ran away. Well, the townspeople came to the farmer, and they were like, oh, that's so terrible. Your horse is gone. That was your mainstay of income. This is terrible. And the farmer said, good or bad, hard to say. The next day, the horse came back. He had 7 other stallions with him, wild horses. The townspeople they came rushing again. They were like, you got 7 more horses? This is fantastic. The farmer just said, good or bad, hard to say. The next day, the farmer's son was trying to break one of the wild horses, and he got knocked off the horse, broke his leg. Of course, those villagers came back to the farmer, and they were like, oh, your son's leg got broken by those wild horses. This is terrible. The farmer said, good or bad, hard to say. They're like, what do you mean hard to say? Well, the next day, the government came through, and they were taking every single able-bodied man into war because they were fighting a war that they needed bodies. They came to the farmer's house. The son's leg was broken. He was passed over. The son couldn't come. The village people came back, and the farmer said, and they said, oh my God, it's so good that he broke his leg, that now he doesn't have to go to war. Good or bad, hard to say. In the midst of this global pandemic, it is so challenging to not focus on just the events. The events are happening, but whether those events are good or bad, it's hard to say. And our perspective is important. How we view things is important. I want to thank you guys for listening. These are just some of the references and where I got information. Lots of great information out there. Happy to take questions.
Thank you so much, Dr. Greene. I learned so much when you're presenting the information like you do. I really appreciate you presenting to the group, small or large. I'm just hoping one day we'll have more than that. But word is spreading, and I just, for those who did miss the information, we're certainly going to have you back here. I was just wondering about what's your opinion about reopening up schools at this particular point?
So that's a great question. I think each individual school system has to risk assess what's going on with their population. It's true that kids are some of the least impacted, but you have to look at your whole system. So I think if you're not monitoring the information so that you can catch it early if people are coming down and you are getting clusters within your school, to figure out what are we not doing well and what can we do better to make sure that we don't continue to spread the disease. And that's going to take a lot of introspection and a lot of feedback both ways, right? So it's not going to just be the administrators that are coming in and telling us, this is how you're going to do this or this is how you're going to do that. There has to be a constant communication about particular risks or opportunities to improve processes. For instance, if you have surfaces that are not wipeable, where, the virus can, stay. These are things that have to be brought up to administrators. There has to be, communication about how do we make sure that our doorknobs are set. We've had to do a lot of risk assessing in the hospital to manage it. And even when we risk assess, you still have people who don't necessarily follow the rules, and then you have transmission in, unplanned ways, right? So a lot of our hospital wards are we have hand sanitizer at every door, every patient door, but there wasn't a focus on like the break rooms. So now we were seeing outbreaks in the break room. So you have to, we have to manage this like it's a chronic disease, and how are we going to live with it? Because it is not going anywhere. You know, you can't get 50% of the country to consistently wear masks. I don't know how they're going to get 50% of the country to even think about taking a vaccine, which puts, again, because of the information, we don't have how long these antibodies last. So am I going to send my kid who's had the vaccine into a classroom or into an arena with people who might not have taken the vaccine, that might be super spreaders, and I'm not sure exactly how it's going to impact my family. So this is not a, oh, once we get this vaccine, everybody's going to get it and it's going to go away. There's a lot that's going to have to be worked out. We haven't stopped air travel. You know, we're working on strains that we know about. You know, there's other strains, there's other, viruses. So we really have to become a vigilant society that cares about each other and not just ourselves.
Thank you so much. Does anybody else have any questions for the doctor? If not, I thank you so much. Look forward to talking to you soon with some for at least for the spring or so. Maybe there'll be some good news by January or February when we have you back again.
I would love that.
In relationship to it's just so very there's just always some, for me, anxiety building. For when I go out, I gotta, remember to put on all this stuff and to have my sanitizing solution in the car and all of this kind of stuff. Preparation for when I have to go out into to the outside world.
Right. But it's going to be like driving a car, right? We're very conscious about what we had to do, put the blinker on, turn the steering wheel. After a while, I'm telling you, I walk through my hospital, I can't even tell you how many times I hand sanitize because I don't do it consciously anymore. It's literally just a part of my workday. I don't touch an elevator button that I don't clean my hands. You know what I'm saying? So it's a change, but it's part of how we survive. And adaptability is how we have survived as a species thus far. It's adapting to our environment.
Right. So I thank you again. Any last words from our audience? Thank you so much.
Thank you. That was awesome as usual.
Right.
Excellent.
And thank you all for coming, and have a good evening. It's so nice to be here and not have to drive. Thank you. All right. Take care. All right. All right. Good night. Thank you for coming. All right. Okay. All right. All right. You too. Okay. Okay.
So
So the what?
the influencer nor the what's that? Chris Canella. They had said they were interested. They didn't come.
No, they didn't come, but I again, I was testing this out for our group for weekend, so I did plan The next one on a Saturday, 2 Saturdays for Dr. Hanfield. I just wanted to see, but this time around, I'm actually sending special invites to those who had already come to the meetings and not so much trust this. And then I have the book, the address book from last year, maybe sending the invite to all the presidents. Because I did send it to the NTA, but even the nurses, maybe I need to do like a special invite. So I'll see how that works out for the next time.
Yeah, I mean, as long as you have them and you have the videos.
Right.
Yeah, I'm trying to see if any